Smokers who undergo anesthesia are at increased risk of numerous complications. Smoking impairs wound healing as well as heart and lung function and can have a serious impact on your recovery process. You will be asked to stop smoking before surgery and potentially refrain from smoking after surgery to assist with your recovery. This can be very difficult, but we have resources available at Geisinger to help you. Your primary care physician can help by writing a prescription for a smoking cessation aid. We also have coaching and counseling services available. If you are unwilling or unable to stop smoking, your surgeon may refuse to perform the surgery. Quitting smoking is the single best thing you can do for your heart health. Quitting will improve your own health by dramatically reducing your risk of coronary heart disease, stroke, and a variety of other cancers. Within a year of quitting smoking, the risk of having a heart attack is reduced by half. Even people who've already had a heart attack can cut their risk of having another if they quit smoking. So make a plan, think about what can help you stop smoking, such as using a nicotine replacement product, and have it ready before you plan to stop. Then make a date to give it up and stick to it. Throw away all your tobacco, lighters, ashtrays. Get support and let your family and friends know you're quitting. Some people find talking to friends and relatives who have stopped smoking can also be helpful. You can also talk to your doctor, nurse, or pharmacist about what support is available to you. You'll feel better, and also you'll have more money to spend on other things you enjoy. It's never too late to give up smoking. Be healthy.